Hi, I am a student from Santiago de Guayaquil Catholic University. I am a medical student. My name is Gino Cañarte and my topic is about treatment of highly drug-resistant pulmonary tuberculosis. Definition: tuberculosis is a bacterial infection that can pass through the air between people. When it affects the lungs, the medical name for this is pulmonary tuberculosis. It can cause chest pain, severe coughing, and a range of other symptoms. I have several videos in my presentation that you can watch if you open the link. Applications in medicine. Etiology. Tuberculosis is caused by a type of bacterium called Mycobacterium tuberculosis. It spreads when a person with active TB disease in their lungs coughs or sneezes and someone else inhales the expelled droplets, which contain TB bacteria. The symptoms could be lack of appetite and weight loss, a high temperature, night sweats, extreme tiredness or fatigue, a persistent cough that lasts more than 3 weeks and usually brings up phlegm, which may be bloody, breathlessness that gradually gets worse. These symptoms can have many different causes, however, and are not always a sign of TB. Diagnosis: pulmonary TB. You may have a chest X-ray to look for changes in the appearance of your lungs that are suggestive of TB. Several tests can be used to confirm suspected extrapulmonary TB, which is TB outside the lungs. These tests include a CT scan, MRI scan or ultrasound scan, endoscopy, laparoscopy, urine and blood test, and biopsy. You may also have a lumbar puncture, where a small sample of CSF is taken from the base of your spine. Treatments. Patients with highly drug-resistant forms of tuberculosis have limited treatment options and historically have had poor outcomes. In an open-label, single-group study in which follow-up is ongoing at 3 South African sites, we investigate treatment with 3 oral drugs: bedaquiline, predominate, and linezolid. Pros and cons. We evaluate the safety and efficacy of the drug combination for 26 weeks in patients with extensively drug-resistant tuberculosis and patients with multi-drug-resistant tuberculosis that was not responsive to treatment. Cons. At 6 months after the end of treatment, in the intention to treat analysis, 11 patients had an unfavorable outcome. The 11 unfavorable outcomes were 7 deaths, 1 withdrawal of consent during treatment, 2 relapses during follow-up, and 1 loss to follow-up. Pros. The number of patients classified as having a favorable outcome in the intention to treat analysis was 98, with similar findings in the modified intention to treat and per protocol analysis. These results had a lower bound of the 95% confidence interval that was greater than 50%. Issue applied in Ecuador. The authorities of the Ministry of Public Health of Ecuador organized a tuberculosis control program in the country. The PAHO representative in Ecuador reaffirmed the commitment to continue supporting the MSP in the fight against tuberculosis and to give it the priority that strengthening its control requires, as a preliminary step to its elimination as a public health problem. They also discussed multi-drug resistant tuberculosis, highlighting the difficulties in treatment and cost. He indicates the importance of the support of all sectors to combat the disease. In conclusion, the combination of bedaquiline, pretomanid, and linezolid led to a favorable outcome at 6 months after end of therapy in a high percentage of patients with highly drug-resistant forms of tuberculosis. Some associated toxic effects were observed, like peripheral neuropathy, hematologic toxic effects, and hepatotoxicity. Thank you.